The mission of Allergy and Asthma Network is to end the needless death and suffering due to asthma, allergies, and related conditions through outreach, education, advocacy, and research. This is Sally Schessler, Director of Education for Allergy and Asthma Network, and today we are pleased to be joined by CEO Captain Bill Kirk, who will lead a discussion with us about weather and what's ahead in the spring of 2021 for respiratory patients. Captain Bill Kirk is a USAF Gulf War veteran, CEO and co-founder of Weather Trends 360. Bill has a contagious passion for the year-ahead weather forecasting technology and has been using that with Fortune 500 companies for 30 years. Bill Kirk studied calculus, physics, and theory at Rutgers and won the Air Force Distinguished Graduate Award from Governor Keane before entering the U.S. Air Force. Bill has a wealth of experience ranging from Desert Storm, the NASA Space Shuttle Columbia, to General Schwarzkopf Queen Knighting, and has supported thousands of F-16 missions. Bill has been featured on Fox, CNBC, ABC's 2020, named on 3 U.S. patents, and published research in Air Force and Wall Street tech journals. He raised $6.8 million from investors and helped the company win 17 technology awards, including Forbes' 5th most promising company in America out of 13,000, and number 17th ranked CEO on Aller's list of 167,000 CEOs. A Bible scholar from Hawaii, Bill learned early in life, to whom much is given, much is expected. Well, thank you for being with us today, Bill. We look forward to what you have to share.
Well, thank you very much, Sally. I appreciate that. I don't know that we've lived up to all those accolades here just yet, but I am the real Captain Kirk. Back in the day, I worked briefly with this pretty famous general. I always joke that I knew him about 2 years before he was famous, General Stormin Norman Schwarzkopf. Sometimes folks enter your life and maybe divinely put into your life at the right time to kind of get you to think differently. And that was certainly the case for me 31 years ago. As meteorologist out of Rutgers, trained in physics and meteorology, but quickly learned that if you want to do longer term weather, as this general mentioned, you need to think differently. Statistics, climate cycles, something that won't change like physics does, which is every day, and we'll talk about that today. So again, I've heard all your jokes. So I've heard all the Captain Kirk jokes, and I've heard all the weather jokes. I know I'm 80% wrong, and I get to keep my job. So you're not going to get any of those over on me today here, but we will move quickly. For about the last 18 years, we've been working with some of these most successful MARD companies. I love working with these folks. Basically, I think we're up to about 143 plus Fortune 5,000 clients, 18 years. In the pharmaceutical allergy space, we've been working with the Aquivias, the pollen.coms, the Bayers, the J&Js of the world. So again, we have pretty much vast experience in how allergies and pollens influence you and I as sufferers. I am an allergy sufferer and a slightly asthmatic sufferer for different reasons. We work with a lot of farmers and small businesses. As Sally said, again, lots of awards, and we do this in 195 countries. So predicting the weather, and we'll talk about how that's even possible. This is our Bethlehem office here in Eastern Pennsylvania. Everything we do is, if you were just looking at traditional weather forecasting, that's physics-based. It changes every day. Your weekend's going to be great. Your weekend's going to be bad, right? It's physics-based. It's ever-changing. So that's not what we do, and we'll talk about those differences. What we have proven with our year-ahead technology is that it's more accurate than a week 2 short-range forecast. So whatever anyone is saying here today for next week, whatever we said a year ago for next week is more accurate by a lot. And again, it's using trillions upon billions of statistical calculations. 24 climate cycles, you've heard of some right now, a moderate La Nina. It is a major weather factor all over the world. It's leading to flooding in Malaysia and droughts in the Americas. So it's there's 24 of those. So a lot of statistics and calculations. As a meteorologist at Rutgers, we were trained in physics and fluid dynamics. The atmosphere is basically a fluid. So it's a fluid in motion. And if you can predict that with physics and computer models, the challenge in meteorology is that if there's just one storm in the ocean, one drop, if you will, so throw a rock in a lake, right? You got that ring that goes out. This is very simple physics, very simple. We could predict that storm. We could predict when that ring of cold front's going to hit you, very accurately. But the reality in meteorology is kind of that bottom chart there, where it's millions of drops and interactions of storms, both at the surface and aloft. So we try to predict all those interactions. If one little rock that you throw in a lake is a little bigger than you thought it was, then every other ripple is impacted. And that's why physics and traditional meteorology is constantly changing every day, right? That's why your forecast is constantly a moving target. So we realized very early, 31 years ago, with some famous profound words from Schwarzkopf, that we couldn't do this. We had to think differently. So we immediately got into, well, how can you predict temperatures and rainfall and snowfall, sensible metrics, outcomes a year out? So we got into statistics, right? If you've had a record hot March in the Northeast, what happens the next year? Well, guess what? If you're one standard deviation math above normal in March in the Northeast, the next year about 95% of the time is cold and snowy. 95% odds. Why wouldn't we go with those odds? So that's what we've done at this point. Now, the problem today is it's a trillion times a billion statistical calculations. So thank the Lord for Amazon Web Services. If we did not have that kind of computing power that is required in the weather space, we wouldn't be able to do what we do. So again, unfortunately, we've had this type of science for a long time, but again, the computing power was the culprit that we just couldn't, calculate all the math, if you will, with the science back in the day. Today, that's again, thank the Lord for Amazon. We've had PhD academics from both Miami, West Point Military Academy, Penn State, publicly state that if there's an approach to how you would predict the weather, temperature, rain, and snow a year out by mile everywhere on Earth, that the way we're doing it is probably the only way at this stage in the science to tackle that problem. Now, in addition to predicting the temperature, rainfall, and snowfall, the next thing we try to predict is outcomes. It's not very valuable if I were just to tell a customer that it's going to be the hottest, driest May in 9 years in 2021, which we believe is going to be the case. If we can also tell them that that means that allergy sales might be up 10%, the best in 9 years, then that's even more valuable information. So we call this our power of 1 degree. And basically what this does is we've analyzed 10,000 seasonal items, everything you buy at your store, at Target, Walmart, Kohl's, wherever you buy your product. We've taken that point of sale data, quantified it against past weather history to predict those sales a year ahead, by week, by store, everywhere on Earth. So some of the ones we'll be talking about today are things like flu. Colder weather in the fall certainly leads to an early onset of flu. So we'll be talking flu here in a minute, but flu's at historic lows for a lot of reasons, but in part due to the weather. So when it's really warm in the fall, we tend not to see the viral spread of flu as quickly versus if it was a really cold early start to fall. So every degree colder, there's about a 2% increase in flu sales. 20 degrees colder year over year, there's a 40% increase in flu sales because more of us are getting sick. The virus can survive longer. Same thing with allergy. Allergy is a warm, dry trigger. Well, why is that? And we'll talk about this in detail here in a minute, but warm, dry weather just keeps pollens that are around all the time, but keeps them in the spring and summertime and the fall suspended in the air longer. If it's cold and rainy and constantly washing out the pollen, you're less likely to be exposed to the pollen. So again, for every degree warmer or drier in the spring, there's a 1 to 3% increase in allergy sales. So if it's 10 degrees hotter year on year, there's a 10 to 30% increase in allergy sales. So we're going to talk about these May trends here because May is kind of one of our, it's usually a peak for both allergy and to some extent asthma suffering. And unfortunately, we have a 9-degree warmer May in 2021, which we think is going to lead to at least 9 to 27% increase in allergy and asthma medication sales. So this is a big opportunity both for the folks trying to sell us the products to keep us healthy, but also a problem for us as humans that are going to suffer. What we've done is we've quantified, we take any data we can get. So we've looked at IQVIA historical asthma index data. We've looked at 3-zip patient level data for asthma suffering and allergy suffering, many different medicines, if you will, and analyzed why did you buy those medicines? Why did a doctor prescribe that medicine to you? So we've quantified weather's influence on that. We looked at 50 plus years of EPA pollution data. Pollution is the same thing kind of as an allergen pollen, right? I mean, the pollution suspends in the air longer from your car, from your power plants, is suspended in the air longer if it's warm and dry outside. That's natural. So if you look on a nice, like today, we're here in Eastern PA, we've kind of got a 42 degree, warm by our standards, dry, no wind. We got a little bit of pollution in the air today. So that suspends in the air longer versus if it's cold, wet, or snowy, that kind of gets washed out. So we're not as exposed to it. We've looked at CDC Flu Data, again, tons of allergy point of sale data. And what we basically found here is, this is just for the mathematicians in the audience, is linear multivariate regression, basically in this case, that warmer, drier weather, we have higher incidence of asthma suffering. When it's colder, wetter weather, we have lower incidence of asthma suffering. So this is just the quantification of the weather. So we found pretty much dry weather year round is going to lead to more asthma suffering. Now, typically in the spring and the fall, it's warm, dry weather that suspends pollens, ragweeds in the fall, all your grass, pollens, trees in the spring. Now you can certainly have some winter allergens. mountain cedar. There's certain other, trees in the west and the Rocky Mountains that certainly can be winter. So it'd be the same thing. If it's a beautiful, even if it's a cool, dry day, you may have those pollen suspended in the air. So again, this is just what we found from a math perspective of analyzing these metrics. Now we're going to look here at our forecast here. So this is our statistical math-based year-ahead forecast. Same thing our big Fortune 500 clients would be getting. And what we see here is the U.S. Central, we're kind of ground zero, we think, for a lot of allergy and asthma suffering here. Again, the worst in 9 years in the U.S. So central and eastern locations likely to have very high allergy asthma suffering this spring, especially in April and May. The most dramatic increase looks like if you look at that map left there, you can see those oranges and reds where it's much, much warmer. So again, warmest in 9 years. So really anywhere from the Midwest to the Great Lakes, the Northeast. The Southwest, a little bit colder than it's been in recent years, so that may be a suppressing factor. Now, if it's cold and dry in the springtime, that can still lead to obviously some pollen levels, but not as severe as we would expect, say in the Great Lakes, Northeast, Ohio Valley, Mid-Atlantic regions. So this is again another area to be Eastern Europe looks really rough. Again, we looked at Southwest Europe where we may not be so bad in the Spains and the Frances. So again, this is just how we can on a high level start to quantify this. Now, this is a spring back to the US. So we're looking at the last 30 some years of springs. And what we see here is that last couple of years, we've had some really cold, wet, snowy Mays for sure. So it's the peak of the asthma season. So last year, for example, was the coldest in over 35 years, decades. We might have to go back to the 70s, 1970s to have experienced such a cold May for the US overall. Well, what that does, again, that suppresses your allergens, your pollens, your pollution. And again, we had COVID back in May, obviously last year, so we suppressed pollution a lot. But the important thing is here, we've had this kind of 2 years in a row. 2019 was not only cold as in 9 years, but it was the wettest in decades, 30, 40, 50 years. So that cold wet was definitely suppressing it. So I guess the message here is, as everyone has always said, and as a mild asthma sufferer, that it's always good to be proactive with the disease rather than reactive. And our gut is that, hey, I didn't have a problem maybe the last couple of years. Maybe I think I'm cured, right? Or my symptoms aren't as bad. Well, I'd encourage you to try to quantify in your own mind what weather might be triggering it, because weather is certainly one of the biggest catalysts for allergic type asthmatic reactions. So kind of keep a mental note of that. Like, hey, you're right. I was out there on a 60, 70 degree day in March and it was sunny and dry and no wind and the pollution was a little high. And wow, I did get a little bit of an attack. So you can keep that mental notice, then you'll start to quantify really what's impacting you. Now, there's a lot of us also that suffer with the wintertime. If it's really cold in the wintertime, we get, right? I certainly, if it's really, really cold, I can get a little bit of an asthma fit, if you will, and hard time breathing. So again, just everyone's a little bit different. And if you just kind of keep a mental note of the weather, you'll have a better sense of, yikes, when it's 10, 20 degrees below normal in my area in January, I get a cold asthma attack. Or if it's 10, 20 degrees above normal in April and May, and it's sunny out, I get a little bit of an attack. So again, every region's a little bit different. 2021, again, we are predicting polar opposite. It'd be more like years of like 2007, 1987. Again, and those were some pretty bad, hot, dry springs. What this chart is showing you here is that we've been in a very wet pattern here in the US. Not so. Right now, we're actually the driest. We have the dry to drought phase across the US, according to the USDA, who tracks drought conditions. We're already at an 8 to 9 year high. So we've come out of 2019, which was a record historic wet year for the US. I mean, across the entire country, only 9% of the country had dry to drought phases. We're already at 62%. And we believe this will be somewhere in that 60 to 70% range for the balance of spring and summer this year. So if you have more dry weather and more dry soils, that just increases drought conditions. Part of these, we'd look at cycles like La Nina, and there's a Pacific Ocean cycle, an Atlantic Ocean cycle, where the solar minimum. These are rare to see these 4 big cycles, and a lot of statistics line up. This is to say this is a potential 100-year event. It's a potential 100-year event. This is something we really rarely see. And as you can see from the chart, we're already nearing historic highs for dry to drought across the US. We believe this expands from the Southwest Rockies into the central and to the east as we go through the 2021 season. So again, just a dramatic change. So if you've not had your issues, maybe it's because it was so wet and the pollens were washed out in your area and you really didn't have those triggers. So this just might be a year where go back and think about those 12, 13s, maybe 18, and how you did back then. What we've done here is just simply took 8 regions. Now we can do this by zip code anywhere in the world, but to keep it simple here today, we've identified 8 regions across the country. The US overall on the top line, Northeast, Southeast, South Central, North Central, Rocky Mountains, Southwest, Northwest. And the reds are just simply when we see a huge change in weather, warm and dry, keeping pollens and allergens in the air longer. So if we're looking at this kind of now couple colds blast, we haven't had this winter so far has been while it's been the coolest in 3 years, we're still way above normal on a national scale. We have been driest in 3 years nationally, below average, and snowfall has been up, but still well below average. So we really have not had a major Arctic outbreak, which can exacerbate. I haven't had my winter asthma attack yet. I'm expecting to have it here probably late January into early February. It does look like the polar vortex is going to make an invasion here. It's been clobbering China and Russia. Russia's right now the coldest in 8 years. They had the record hottest winter of all time last year, and right now Russia's going to have one of the coldest winters in 8 years. So the polar vortex has really been camped over China, and recently, as you saw in headline news, in Spain and Europe, we're going to get a minor intrusion of that. Probably won't last long, but it's going to probably be the last week of January into early February. So that's why we've highlighted that blue area there. Northeast, North Central US, they're going to take the brunt of this most likely. So if cold weather is a trigger for you, this might be the period where you're going to see the coldest conditions of winter. The red areas are where we see, again, those hot, dry pollen allergens suspended in the air. So we highlighted 4 major weeks here on a national scale, at least. March 20th, so like the 14th through the 20th of March. These are week ending dates. Looks to be the first really strong nationwide surge of allergy, pollen. April 17th, so the 11th through the 17th, looks like to be another big, strong, almost nationwide surge. And then really concerned about May, which again, we have the hottest, driest in like 9 years. So this is something we haven't seen. We actually say hottest, driest in 9. I could actually argue that this potentially could be the hottest, one of the hottest Mays on record. It's that type of cycle. It's that type of pattern. A lot of suffering under that situation. So we just be very mindful of that. And this is the peak, I believe. Early mid-May is typically the peak of the asthma allergy suffering in terms of the data, in terms of the statistics of sales, and both over the counter or at your doctor's script. So be concerned about that period for sure. We look at this in chart, and I apologize, this might be for more of the techie and the doctors and whatnot on the call here today, or the big pharma companies. There's 2 ways to look at the weather. One is from a business perspective. So if you're a pharmaceutical company or a medical or a hospital wanting to understand how's this surge going to be different than last year, then we would look at the data, this forecast data on the left charts. So those bars are suggesting how we see the weather trends on a national scale trending versus last year. So what we see is the blue bars are simply meaning it's going to be colder than it was last year. So even though we have March colder than last year, we can look at the chart to the right, which is how maybe a consumer or a sufferer might want to look at this. The red bars are just simply where we think the temperatures on a national scale are going to be way above average. So what we see here is that, yes, March was the 3rd hottest in history last year. This year we expect it to be cooler, not going to be the 3rd hottest in 125 years, but maybe the 10th hottest in 125 years. So you and I as sufferers would look at the chart on the right, because we see March, all those 4 red bars up, in the early part of March dry through mid-month. That's going to be kind of our first good trigger of human suffering. Now, last year was epic. If you look at the sales data for allergy and asthma medication sales, March went through the roof. COVID certainly was part of that, but also the 3rd hottest March in history was a big part of that. So there was 2 things that lifted the near record sales of allergy and asthma products in March last year. So this year, those sales will likely be a little bit softer, but still strong by historical standards. And then again, picking up through the mid-Aprils and especially the May. So it's a much longer season than we experienced last year. Last year we had March, and then April, May got really cold and wet and kind of snowy across the country. So again, we just want to key in on those middle months. Mid-March, mid-April, mid-May are kind of some of the really bad periods that we anticipate here for the US overall. Now, the good news is we're all obviously consumed with COVID is that flu is at historic lows. We had, I don't know, 65,000 plus people in the hospital last year this time with flu conditions, pretty much a type B. It was that green line left chart there. So we had kind of a nationwide, widespread flu outbreak this time last year, type B. Then we had a type A surge in February, that second peak. And then the third one, arguably, may have been also type A flu as well. Who knows how much COVID was in that flu version chart left there. But the bottom line here is we've had about 1,000 people in the hospital right now due to flu, versus 60, 70,000 last year. So certainly social distancing and mask wearing, and you don't send your kids to win the I'm in school every day award, right? If they're sick, that education has certainly been a huge plus to pretty much eliminating the flu season this year. So that's good news. We're not battling two viruses here, we're battling one. COVID, obviously, you hear all the time from Tanya and team about, again, how those trends are trending, but at least on the surface here, it appears that maybe we're over the hump. The purple line is at least the death peak, which happened back in November, so maybe we're home free here. We don't want to, it would be bad to have another huge COVID surge here in the middle of a very bad allergy asthma season. Those are complicating factors. So let's hope the COVID trends continue, because with a really bad allergy asthma season, this would be very concerning if we're going to have another spring like we had in 2020 when we were peaking in March and April with COVID issues. So let's hope, pray that this is not the case as we go into 21. If you're going to believe anything we had to say here, you would want to have confidence in that what we say is accurate. So we validate 32 million locations of our year ahead forecast for temperature, rain, and snow every day. So everything we say, we always validate. So this is, again, a chart. Bars are our forecast, dotted lines actual. If we're perfect, that dotted line would be on the tip of every bar. I always say here that, while I had to kind of data dump everything I was taught with physics and fluid dynamics at Rutgers, a famous general, again, got us to think differently. And I think we really have found a better way when it comes to longer term forecasting that's statistical math-based that works. So there's probably very statistical low odds in the 1 or 2, 3, 4, 5% range that this May is going to be cold. I can almost assure you that won't be the case. So if we can get that weather right, then we can get those outcomes right. Now, we have a lot of free tools. I would, again, encourage all of you that you just kind of be more mindful of, just your own activities. If it's a warm, dry spring, of course you're going to be outside mowing the lawn or trimming the bushes or playing with the kids or at the park, flying a kite, right? You're going to do those things, but kind of make some mental notes as to, what, wow, it's 10 degrees above normal. And while I'm enjoying that time with the granddaughter, maybe it is giving me my attack. Be mindful of that. So this chart here is a free one on our website. Again, this does 32 million locations worldwide. So what we see in this is the red line is our temperature forecast. The dotted line, red line, is kind of average. So let's just say that you're like me, I suffer from cold weather. I'm going to get very concerned about January 24th, 5th, 6th timeframe, maybe into the 27th, because I see that dark red line way below average. That's really cold for me, and that is a trigger for me. So I'm going to be mentally making a note here that I know the polar vortex is coming. I'm a meteorologist, so I see it coming. But you could look at this and say, yikes, yeah, I share Bill's concerns. That will hurt me too. We got another big polar vortex surge potentially in that, let's say, early February timeframe. So that could be a big one as well. After that, we think it starts to warm up. We think this may be a two-hit wonder here with a minor glancing shots of the polar vortex. So if this is just one way how you could use a free tool to kind of get a sense of when you might have your conditions that would trigger your event. Now, if we were looking at this in the spring, let's say this was a March, April, May timeframe, I'd be really concerned about that first few weeks there where I'm way above the dotted line, I'm way above my average, and it's dry and sunny. Look for the winds to see if it's windy, and that just means I'm going to have a lot of pollen, a lot of pollution, and I'm going to be suffering. So weathertrends360.com/chart/consumer is the free way to get to this kind of 30-day outlook. We've built a prototype here, and we're very proud to be working with the Allergy and Asthma Network folks. And again, hopeful soon that we can take some of this domain knowledge that we have and make it freely available to everyone. So this is something we have free on our website. It's a prototype that takes all that science and data analytics that we've already analyzed. So weathertrends360.com/asthma, and it's a 14-day global outlook. So this is keying in, I believe, on that 24 January period. So we see all that red invading North America. It's been record hot in Canada the last few weeks. They have not seen the polar vortex. We see it coming. So if you got a cold weather trigger, this 24 January outbreak, East Coast, Canada, it's coming. So again, just another free tool to kind of help you. Ways we're trying to help the industry, right? And we're open to any and all creative folks on the call here today. Again, we can predict in theory these medicines by week, by store, by hospital, what the demand lift will be everywhere in the world using common sense, using data. One way we've tried to help the Allergy and Asthma Network folks is just kind of keying on some hotspot cities. This was Atlanta. Again, we want to help the patients and to understand that they have a bad spring coming. And if they can be proactive about managing that, like, look, You haven't used your medications the last couple of years. This is the year maybe to start taking it. I think every doctor will tell you if you can take your medications before you have the symptoms, then you're more likely to not have a major issue, right? Versus if you wait and be reactive until all of a sudden it's here, then you could be suffering a lot more. So again, just proactive thinking here. So for the medical industry, again, what we do is far more statistically science-based, but again, we would predict by week, by location, the lift in asthma sales or allergy sales, or really anywhere in the world. So again, it's a lot more scary charts for the consumer here, but again, how a doctor might look at the data. So Sally, at this point, I will take a break. It's 3:30, and take any questions if there are any.
Well, there are quite a few questions. Thanks so much for what you had to say. And just so our listeners know, I believe whatever Bill Kirk tells us, because last year I asked him to predict what the weather was going to be for my daughter's wedding, and he predicted it spot on, and we had a beautiful day. So Bill, I'm with whatever you tell us here. I've seen
Well,
it bear out.
glad we didn't make a bridezilla, right? We didn't want to have that.
Oh, she never would have been. But here we go. Our first question is, so how accurate is the Almanac that comes out every year predicting a year in advance?
Good question. So I always used to joke, I still get a copy. For the most part, they use a solar cycle. So there's some validity to using a solar cycle, but it's not going to work on the scale that they're trying to do. So it's folklore to some extent, some of these. But if you use a solar cycle, the challenge with that is you go through a 7-year minimum cycle. Right now, we're at the bottom of a 7-year sun, just weak in active sun. You can have potentially colder weather. But as you're seeing right now, and last year, for example, we did not have a bad winter. We had the least snow in 8 years. We had a warm winter. I think all the almanacs were predicting epic cold and snow of all time last year. That didn't happen. So the challenge with solar cycles, you can be off by a couple of years and totally miss the weather. Solar then cycle's about to go into a active phase, and then you can get hotter conditions and whatnot. Again, it's neat, it's folklore. Everybody always wants to know, but I used to make the joke that if it's Walmart used to plan their entire business, billions and billions of dollars on the Almanac, because when we first met them 20 years ago, and I said, you're going to plan billions of dollars on $7 book that's in your checkout aisle. And they said, you're right, that's probably not the best thing. So it's neat, it's folklore. Sometimes it's right. I think a Canadian firm validated it about 38% accurate. I don't know. It's neat folklore. I buy a copy.
Well, that's good to know. Now, Bill, we do have some questions that have a medical bend to them. So if you at some point want to defer a question, please don't hesitate to. But this question is, I get round the year allergy shots. Should I increase the frequency of these shots before spring trees bloom?
I'll use that Holiday Inn commercial, right? Just because I stayed at the Holiday Inn doesn't make me any smarter here tonight. So yeah, I'm not a doctor, so I wouldn't be able to. I think, again, most doctors and medical professionals, right, in this space, allergy and asthma, will say it's better to be proactive, the very things we tell our big Fortune 500 companies, than reactive, right? So if again, I just evaluate, hey, Bill, I have not had a bad, for me, it was a fall 5 years ago. It was epically hot and dry. I went through a dust cloud of leaves, and I had a wicked allergy asthma fit that lasted 4 months. Had I been a little more smart about it and proactive about it, I probably won't make that mistake again, right? So I would encourage that, follow your doctor's advice, of course, but again, stay on top of it. This is a year not to think that, oh, the last 2 years haven't been bad. Well, the last 2 years haven't been necessarily bad because we had some pretty cold, wet springs other than March last year. So this will be the year to be proactive, planning, at least monitoring your weather to see how quickly it's changing, and stay on top of it.
Well, and I agree that, first of all, you should definitely discuss this with your allergist. If you don't have an allergist, it sounds like a great year to get an allergist. But also, many allergists do say medicating ahead of time before it all hits is very important. So the next question is, when you're referring to dry weather, are you referring to the humidity or lack of precipitation?
So so several things here. With the actual analysis of predicting allergy sales, it's the amount of precipitation. And again, you have to think about the things that are predictable. So we can predict weekly precipitation levels, rainfall, snowfall, a year out relatively accurately. So if we see 10 dry weeks of really dry weeks, that's going to be a trigger for a lot of suffering. So that's what we're quantifying. And the reason for that is that, in part, if you think about it, if you have a lot of rain, like we had in 2018, when we had the least drought in history across the US, you're just washing out the pollens, right? So pollen's always there, right? It's every year, the same amount of trees, same everything, right? It's just that if it's getting washed out all the time because of rain and you walk outside after it just rained, you're less likely to be exposed. So the exposure is less in those cold, wet, snowy periods. So if we can wash it out, we're going to minimize the suffering and minimize it ultimately decreases the sales. And we've quantified that with allergy for sure. There's significant 5, 10, 30% swings in allergy sales every year just because of the weather. So yeah, it's really focused on the amount of rainfall. Now, when we have dry to drought, as we're going to have more like 12 and 13 across the US, the farmlands, think about it. Farmers are out in their fields, dusty, planting, dust and everything's pollens that are, sitting around are going to get all stirred up and then stagnate with hot, dry weather, high pressure, sinking air, kind of stagnating the air. It just screams that there's a lot of issues here for folks in the Midwest, Great Lakes, Northeast, East Coast, really a lot of places for sure where you're just going to have all those weather triggers to lift. So it's a combination of everything, right? That drought and the farmers doing their dusty harvesting or planting rather. So yeah, it's a challenging year.
It sounds like it. Our next question comes from Eric, and he asks, is it possible to predict wind patterns? For example, in Arizona, where drought conditions are prevalent, dust storms are becoming more prevalent in drought areas. So can you predict those wind patterns?
No, so again, what we're predicting are sensible metrics. Any of the temperature metrics, high, low temperatures, growing degree days for farmers, cooling, heating degree days for energy companies, rainfall and snowfall. But indirectly, if I tell you it's the hottest, driest May, let's say in 9 years at least across the US, the Midwest, Great Lakes, Northeast. So I tell you it's the hottest, driest in 9, what does that mean? Well, what would create hot, dry in May? It's not a northerly wind. It's not a lot of cold fronts that are windy. It's big high pressure, right? Big high pressure, southwest flow, which tend to be lighter winds, not entirely lighter wind, but a southwest type flow, southerly flow across the US. That means not a lot of thunderstorms, not a lot of hail, not a big tornadoes. So in May, we are going to predict indirectly that tornadoes and hail damage, like this year, was way down. We expect next year it will again be way down. So not entirely, but you can get a sense that if I was telling you it was the coldest, wettest, and snowiest in 8 to 10 years, then I'm predicting a lot of cold fronts. Then in theory, you are saying very windy because cold fronts are naturally windy. So no, this indirectly you could make the inference that it won't be windy because of the atmospheric conditions that create hot, dry, versus the conditions that would create cold, wet would be windy.
I find this so fascinating. I wonder sometimes if I should have been a meteorologist instead of a nurse, but it's a little late for that. So we actually have listeners from all over the place, Bill. And this question from Susan says, I didn't see Alaska on the map for 2021 spring allergens. The map shows 62% of the US with dry soil expected. Can you speak to Alaska?
I think it's on map 10. I apologize. I suppose I could get back there warp speed. We have Alaska pretty cold. So if anybody's getting polar vortex, it's maybe up there in Alaska. So again, they're kind of see there on that map. So again, a little bit colder out there. So they can at least spring. So now again, we want to be careful. Alaska, right? Your season may be far removed from our, February, March, April, May, maybe down here in the lower 48 might be more, May, June timeframe up in Alaska. So we'd have to look specifically up at Alaska. But again, I would encourage again that 30-day chart that's on our website and our app. We have a free app, WT360 Lite. It's on the app and Google Play Store. It'll go out a year. So you can go up to Alaska, Fairbanks, wherever, and show exactly what the weather trends are likely to be. So if you saw a lot of days that maybe were in the 70s, like, wow, that's way above my norm up here in June, then that would be your trigger point if you're a spring asthma allergy sufferer. So again, check out the 360 Lite, WT360 Lite. It's a free app. It goes out a year anywhere in the world, so it might help with that. But this map, it just suggests at least through May, cooler, which is wetter and windier. So probably not too many early issues in Alaska.
Thank you so much. I'm going to take this next question, which is, how can we compare or identify when a child has asthma versus COVID-19 symptoms? And we've provided you with several resources from Allergy and Asthma Network. If you look on our website in our COVID Information Center, we have a couple of great infographics for you. One of them you're going to want to look at is distinguishing cold, flu, COVID, and allergies. And we've got a chart that'll show you what the differences are and where they overlap. And if you're a school nurse, we have an infographic for you, because we really had a heart for school nurses at the beginning of the the pandemic of, okay, if a child comes in and says they're short of breath, what do I do? How do I know what it is? So, in that there's an infographic called, Asthma Care at School during the COVID-19 outbreak, and that can help you too. It shows you to think about, the viral aspects, because you certainly aren't going to see a fever with asthma, but I know that many schools right now, I've been talking to people around the area, and they've said, if a child has any symptoms at all, they go home and they get tested. But if you really are concerned about that, take a look at some of our resources. We have resources, infographics, as well as school resources, and that's in our COVID-19 Information Center at allergyasthmanetwork.org, and I think that can help you out. Okay, next question is, if I'm having trouble accessing Weather Trend 360, do you have any tips?
Well, I hope you don't have any issues at accessing Weather Trends 360. So there's a website, weathertrends360.com or WT360.com. So there's a lot of free content on there for, again, we're a business focused company, obviously. So we're not necessarily an AccuWeather, if you will, but there's plenty of AccuWeather type weather forecasts. We've been audited in our short range forecast to be, at least lately, we've been trending in the top one out of 30 some companies. So our short range 14-day forecast certainly has made huge strides here in the last few years. It's typically, us, IBM, AccuWeather's the world. They're all probably the big ones that are highly accurate in that short range weather forecasting period. So the app is pretty easy. WT360 Lite, again, literally you just type in your city and slide a little slidey bar. I always say, let's say you've got a big wedding event and you're worried about it because you're traveling someplace, yikes, I may have an attack of allergy and asthma, and it's, my daughter's wedding, so you could actually go out to July 15th, that Saturday or whatever, and see what the weather's going to be in that location. So it's a year out, always a year out. So it could help you kind of think, yikes, that might be a bad period for me. And at least, you're obviously not going to cancel going to the wedding, but would know if you're going to have some issues. So hopefully it's easy. We've tried to make it easy, but if not, just go to support at WT360.com and we can certainly answer questions.
Thank you so much. Next question is from Sandra. She says, as a school nurse with many elementary age students suffering from seasonal asthma, do you have school resources that would be appropriate to increase health literacy? At Allergy and Asthma Network, we have a lot of resources. Take a look at our page with Asthma at School. And Sandra, if you have something specifically you need, email me and we'll see what we can do, because we're always ready to create new resources. This year we're going more digital, and sometimes when you're dealing with a video instead of the written word, that does bring the health literacy level down. So hopefully we'll be able to help you out. So Erica asks that you were talking about hurricane season. She goes, how will hurricane season impact allergy season?
Well, good question, because we are predicting an epic hurricane season again. So obviously we had 32 named systems this past year. It was a record shattering of all time hurricane season in terms of the number of hurricanes. Louisiana was ground zero. I think they got hit by 5 or 6 systems this year, epic. The Northeast, we got hit mid-Atlantic here by a CS that wiped out power to 13 million people for a few days. So those are important metrics. Again, we are actually predicting our early hurricane outlook. Now, I always say this is a little more dartboard science, because the best you can do with hurricanes is just kind of get a sense of how bad the season will be. So we had predicted it'd be the 3rd most active in history this year. Turned out it was the 1st most active in 165 years. Next year, we think it's right in that range, top 3, top 2. So probably in the 2025 named systems. Florida is our bullseye. Florida kind of escaped it this year. We don't think they escape it in 2021. So if you just look at a lot of cycles and statistics and the pattern we've been in, Florida got very lucky this year. That's the bottom line, right? Louisiana got very unlucky. It was a record event to have 5 systems hit Louisiana. That just has never happened in history. Florida could have easily had 2 or 3 of those. This might be Florida's year, unfortunately. So think about those. Recall the storm, I forget how many years ago it was, but upwards of a decade ago, where 10 million people had to leave Florida, and then ironically, they all left for Georgia. And I think the storm ultimately hit up in Georgia too. So think about that, right? I mean, you got to have your medications ready. You can't just, and you also have to think about these events like Harvey a few years back in 2017. Hurricane Harvey basically gave everybody about a day's notice. You had next to no notice, and then you had 50 inches of rain. and the city was underwater. Right? So you need to think about those dire situations. If you're going to hit by a hurricane, you may not be able to rush home to go get your medicines or go to your doctor or do those things. So I think this is the year to definitely not be complacent with hurricanes. Especially Florida, East Coast, I think is the target zone this 2021 for, like I said, 2025 system. So in terms of how they would impact allergens or whatnot, there's not a lot of, again, now they can, and I'll say this, I know they did with Isaias. If a hurricane comes up the coast quickly, as Isaias did, it was only Cat 1, it hit North Carolina and then came right up the East Coast. We had all kinds of weird stuff up here in our Northeast. I mean, it smelled like Florida. It smelled like the tropics. So hurricanes there's been cases where millions of birds have actually been trapped inside the eye of a hurricane. So birds that were native to the Caribbean got landed in the Northeast as soon as the hurricane eye dissipated, and all of a sudden you have these tropical birds that are in Pennsylvania, right? So weird things can happen with hurricanes. So they can certainly, again, a lot of it would get washed out, but if a hurricane did go over Caribbeans and there happen to be some pollens or different things that you're not used to and dumps that in Florida, it certainly could be a thing that could trigger you if you weren't used to that type of pollen or whatever might have been transported. So again, I'd be more concerned about just being prepared to have your medicines and supplies ready well in advance of the June 1st starting of the season.
Oh, that's very, very smart. And even just with the May uptick in allergies, this is a great time to be thinking about being prepared. Our next question is from Hector, and he wants to know, how severe was the impact of the fires out west on asthma sufferers in the east?
This was an interesting year, actually, for a lot of things, both dust off of Africa and fires from the west. This was not an epic fire season. I mean, if you went back to the 30s, 40s, 50s and looked at the wildfire data back then, those were some epic fire seasons. In recent decades, past 30, 40 years, we've gotten better with wildfire management. One of our employees, our CEO, chief forecaster, spent many years in the firefighting business out west. So by cutting the underbrush, the thing that causes the wildfires out west has nothing to do with, they don't get any rain in the summertime anyway, right? So typically in California, at least, it's a semi-arid climate. April to November, it's dry every year, no matter what. They get their winter rains and snowpack in the wintertime. What happens in really bad, wet, snowy winters, a lot of underbrush grows then in the spring. So if you get a lot of underbrush in the spring, and then naturally it's going to dry out by summer, you have a lot of underbrush and fuel for fires. This year was interesting though, because you actually did see, just by dumb luck, high pressure and how the jet stream winds flowed and the height of some of those fires in terms of reaching the upper atmosphere. We had it here in Pennsylvania. I mean, you had pretty much the entire US had some of those really thick. Now, fortunately, in a lot of cases here in the East, the fire levels were high. The smoke was 10,000 plus feet up in the air. But in some areas of the Midwest, it actually did, and even the south part of the country, it did get all the way to the surface. A bigger event or two is what came off of Africa. Early in the season, back in April, May, we had the unusually parked high pressure in the Atlantic, and it swept all the Saharan dust. It does it every year, but the way it just locked in, it transmitted all that Saharan dust to the southeast. And so like New Orleans had thick, you would think they were in the middle of an epic wildfire. It was just thick haze from African dust. So again, it's just a case of it. There's certainly pollens and allergens and things embedded in all that air. It's bad air quality for sure. So if you triggered just your asthma from just bad air quality, that was certainly a trigger back in the late spring, I believe. So yeah, those are definitely things. Now, this year, obviously we're having next to no rain in California, and it's probably the case in this cycle. So you're probably going into next year with less underbrush to some extent. So it's not to say you're not going to have wildfires in California this year, but you just have less. The more areas that got burnt up this year, obviously, are probably not going to burn up next year because there's nothing to burn. So, maybe not as a severe a season in 2021, at least out in areas of California where it's already been pretty dry for a couple of years now.
Thank you so much. Hector did put a postscript on his question and said, by the way, I love the name as a Star Trek fan. He appreciates it. So we'll go on with a couple more questions here for Captain Kirk. So one person is asking, can the recording be sent to you? Yes, the recording will actually, the link to it will come to you in a follow-up email after the webinar, a couple of days after the webinar. But if you ever want to look at the recording of any of our webinars, you just go to allergyasthmanetwork.org. You're going to look for news right up underneath the title, and then go to webinars, and all the recordings are there. So our last question, unless someone submits another in the next minute or two, is how can individuals and my local government get year-ahead forecasting and hotspot outlooks?
Well, if you know any of them, send them to some Bill Kirk at weathertrends360.com. We don't work currently with, we are in early discussions with some governmental type agencies, but very early. Our core business has been big retail, and then the Walmarts, Target, Kohl's, AutoZones of the world, and then we got helping all their suppliers, so the Johnson & Johnson and Anheuser-Busch's and anybody that makes seasonal products, and then Wall Street, and then agriculture and farm. So, but most recently we've been working in allergy and asthma for quite some time, 18 years in allergy. So we just believe this is proactive planning. You're correct. I do believe that if governmental agencies were a little more proactive, they certainly could, right? Let's say we were predicting, I know on one of these calls back in the fall, actually was very early fall, late summer, we warned that we thought that this flu season would be non-existent. And a lot of that is just from a weather perspective. If you have a really warm fall, you delay the kids getting sick, kids don't spread it, the virus doesn't survive as long in warm weather versus really cold wintry weather. And that's turned out to be the case. Now COVID, social distancing obviously improved that flu trend dramatically. But you could look to South America, Australia, and all those southern hemisphere that had their flu season, and they had non-existent flu as well. So, but again, you heard the headlines, right? It's going to be epic flu season and epic COVID season, and we're going to be battling two viruses at the same time. And I heard that nightly back in August, September, October. No, that did not happen. So you're correct. It would be wise for everyone just to. I always say that these 143 Fortune 5,000 clients are not. They're not uneducated, right? So they're not, using dartboard science with what we do. They're making sound multi-billion-dollar decisions with what we do, and we believe we could help those agencies. So again, if you know them, please send them my way. Happy to talk to them.
So the last couple of questions all have to do with your website and the app. So if you could repeat how to find the website and how to find the app, our listeners would appreciate that.
The easy way to get to the website is just WT360.com or weathertrends360.com. And again, there's a dashboard page. I do a weekly video talking about the world trends and the weather over the last week and what's happening in the next couple weeks. And very frequently, I'll talk months ahead on my captain's log video that I do there you'll see the dashboard quick cast page on our website once you get in there. And there's it's got your hourly weather, it's got your 14-day forecast. There's all maps you can around the whole world. You can get 32 weather things if you like to look at the winds or the temperatures, the rain or the snow. It's all on that one dashboard page. The other thing is the App Store, Google or so Google Android and or iPhone, Apple, WT360 Lite, Lite, or WT360 Pro is a 99-cent app. They both do the same thing. The only thing with the 99 cents, you pay once and you got it forever, is that app is no ads. So don't scream at me for the inappropriate ads that they might put on the WT360 Lite ad. I have no control of that. But they both do the same thing. And it's neat. You can just do this little slider bar. And I think right now those apps they're always rolling almost a year out. So right now those apps should be showing you through, I think, December of 2021 of this year. So they should all be out through at least December of this year, everywhere in the world. So it's a neat app. So once you figure out again, I can't stress enough, if you could just start to monitor your suffering when you have attacks, just keep mindful, like, wow, they just said it was 20 degrees above normal and it's dry and sunny and windy and it's hazy, right? You just keep mental notes of that because everyone's slightly different, what triggers their conditions. I think we'll all be smarter if we can eventually get all this data, people analyzing that kind of data, that why Bill Kirk got an attack, but you didn't, and then you get one and I didn't get it. We're all different a little bit.
Thank you so much, Bill. We're at the end of our questions, and I would just like to thank all of our listeners for joining us today. We hope you've gained some insight into the future of allergies and asthma for early 2021. Please join us next time on Thursday, January 20th, as we present another in our COVID-19 COVID-19 webinar series. And the title is COVID-19 Vaccine, Allergy, Anaphylaxis, and Answers. If you also, on our next slide, you'll see that on January 26th, we're going to have a webinar titled Vaccine Hesitancy. And this is not just COVID vaccine. This is the full scope of vaccines, and it's how to improve respiratory outcomes. Dr. John Kelso will be joining us, and this is what part of our Advances in Allergy and Asthma series. There is continuing medical education and continuing nursing education available at a reasonable cost for that webinar. And the Allergy and Asthma Network presents webinars each week that are of interest to healthcare providers, patients, and families. You can join the network and receive emails about all of our offerings by clicking on Join at the top of our homepage, or register for our next webinar on our webpage. Look for News, then Webinars, and click on the link. Our web address is allergyasthmanetwork.org. Thank you again for joining us. This is Sally Schessler for the staff at Allergy and Asthma Network. We hope you have a healthy spring of 2021 as we work every day to breathe better together.